Okay, my name is Mike Curley. We'll be doing the abdominal exam today. I have my stethoscope and pen. Patient. TV's just on for lighting. Okay. All right, here's Mike Curley. I'll be doing the abdominal exam on you today. Just let me know if you feel any abdominal discomfort, any tenderness or pain or anything like that. Making sure that the patient is lying supine with the head of the bed slightly elevated, arms relaxed at her side. Abdomen is exposed from xiphoid to symphysis pubis. And we'll try to maintain some privacy during this exam. So first I'm going to inspect your abdomen. So I'm assessing for the contour, symmetry, skin characteristics, for anything like scars, rashes, pulsations, whether it's final rounding or scaffold. Abdomen appears flat, symmetrical with even contour, skin smooth, intact, uniformly colored without scars, lesions or striae. Umbilicus is midline and inverted with no bulging or signs of hernia. No visible peristalsis or exaggerated aortic pulsations are observed. So next we're going to auscultate or listen. So I'm going to listen to the 4 quadrants in your abdomen. Listening for any for the regular noise. So I'm going to start with the lower right quadrant. Mouth sounds are active in all 4 quadrants. Next, I'm going to listen for friction rubs over the liver and spleen. And I'm going to use the diaphragm on this as well. So I'll start with the liver and then go to the spleen. Alright, no friction rubs heard over the liver or the spleen. I'm listening with the bell over the aorta, aortic, renal, iliac, and femoral arteries in that order. Listen for bruise. Okay. So no bruise heard over any of those major arteries. Next I'm going to listen to for any venous hums in the epigastric region and over the umbilicus. Okay. No venous hums detected in the epigastric or umbilical regions. Next, we're going to do percussion. So I'm going to percuss your abdomen in 9 regions to identify tympany or glomus. Sounds appear tympanic for the most part, with some dullness over some of the major organs. Next, I'm going to check your liver. So I'm going to percuss down the right midclavicular line from just below the breast until dullness is heard. This indicates the upper border of the liver, and then I will percuss from the upward from the right lower quadrant until dullness is heard. This will be the lower border. So if you just pull up your bra foam a little bit there. You can relax. I have a ruler, but I do have this. This is going to tell me it's about 6 centimeters, which is normal. And then I'm going to percuss over the spleen. I'm going to have you breathe in, and I'm going to let you know when to do that. Okay, go ahead and breathe in. You can breathe out. Okay. Alright, so spleen remains tympanic during inspiration, which is normal, indicating no enlargement. Next I'm going to palpate. I'm going to palpate the I'm going to palpate using some light touch initially, and then we'll do a more deeper touch for any tenderness or guarding or any superficial masses. So my hands might be cold. I'll do a little deeper. Okay, no mass is felt, no tenderness or guarding. Abdomen feels smooth and soft. And then I'm going to palpate the liver's edge. So I'm going to have you, in a minute here, breathe in. Okay, breathe in for me. Breathe out. Okay, it's not palpable. If it was palpable, it would be smooth, firm, and had defined edges. I'm going to do the spleen next. Okay, breathe in for me. Breathe out. Breathe in for me. Breathe out. Okay, good. Spleen's not palpable either. That's a normal finding, not enlarged. Next, we're going to do the kidneys. So I'm going to have you sit up, put your legs to the side for me. I'm going to move the camera so I can see better. It's going to be a little bit more difficult to percent. Okay, so rib cage. So palpating right about up here. I don't feel any masses, and there doesn't seem, go ahead and stay there. There doesn't appear to be any tenderness. Next, we're going to check your costovertebral angle tenderness. I'm going to percuss over the kidneys. We should find no discomfort or tenderness, so we'll see. So normally I would, okay, find that angle. Okay, doesn't appear to be any tenderness or guarding. Okay, you can go ahead and lay flat. I'm going to check your abdomen again. We're going to check for ascites. So just move you back. So a patient does not appear to have ascites, but perform it as if there's a potential for that. If it was suspected, if the size was suspected, I would check for tympany or dullness and the presence of free fluid in the abdomen. So I would normally percuss the area central to tympany. So in this area, then I would move outward until there was dullness heard. So that way, and then I would mark that line. That would map the border between tympany and dullness. So no fluid weight or shifting dullness, really appreciated, which indicates absence of free fluid. Next we're going to check for appendicitis. So we're going to check Robson's sign. I'm going to apply pressure to the left lower quadrant. And if it causes pain in the right lower quadrant, then we're going to have a positive sign. I'm going to check the left lower. And check for any rebound tenderness. Doesn't appear to be any tenderness, so no negative test. I'm going to assess for psoas sign. I'm going to have you raise your right leg against resistance. So you can kind of bend your knee and then raise your leg up. Okay, any pain or anything? Okay, you can put your leg down. Psoas sign is negative. No pain or tenderness elicited. I'm going to check the obturator sign. Flex your right hip and knee, and then internally rotate the hip to elicit pain. So if there's pain, then we have a positive sign. So you don't have to do anything. I'm going to raise your leg up and rotate your hip inward. Any pain in your abdomen? Okay, then that's a negative obturator sign. Lastly, I'm going to check for cholecystitis. I'm going to check Murphy's sign, palpating right below the costal margin while you take a breath. And I'm going to observe for any abnormalities. So there's your rib cage. So I'm going to palpate here, and I'm going to have you breathe in and breathe out. Okay, so no sudden cessation or inspiration due to pain. You're able to complete the whole inspiration without discomfort, no tenderness noted under the right costal margin, so Murphy's sign is negative. Okay, thank you so much for your involvement today.